Welcome back to another episode from the Optimal Body Podcast. I'm DocJen.
And I'm Dr. Dom.
And today we are talking about pelvic girdle pain, also known as symphysis pubis dysfunction. Is very common in pregnant women, which I am. So let's talk about it. So I'm really excited to dive into this topic, especially as I am currently pregnant, just stepping into my third trimester in just a couple days. So This is really relevant information that I am kind of going through and not necessarily experiencing. And so I'm excited to talk about why that could possibly be. But before we go into that, there are a lot of other videos that I show a lot of the exercises, the mobility, the things that I'm doing to actually help myself during this pregnancy and not even needing to be pregnant. So any kind of pain that you're having, we've talked about it on different podcasts. We've shown videos. So if you haven't subscribed yet, please hit that subscribe button, comment below on other diagnoses or pains that you're feeling so that we understand how we can continue to help you on these episodes. Yeah, so we're talking about this pelvic girdle pain specifically around the pubis symphysis. So if we think about the pelvic bones, right, we can think about our hips, our pelvic bone, the things that we put our hands on. It's in the front where the bones connect is our pubic symphysis. And we have this little cartilage that helps to connect it. And there's very little movement or mobility that's typically associated there. But it's super common to have pain and dysfunction.
You know, our pelvis is preparing to deliver a baby, and the female body or anybody delivering is going to be releasing hormones. That's relaxin specifically starts to make some of those ligaments a little more lax. So where we've normally had a ton of just inherent stability in the pelvis, we're going to have a slight bit more movement, and that can cause our body just to feel unstable and unsafe where we've normally had stability. And
instability is more of this increased sensitivity to our tissues changing based on hormones and that relaxin that he talked about, and ligaments kind of creating more laxity around the area. So this creates this increased sensitivity with our tissues, which tells our brain, hey, something is different, something is wrong. And it can perpetuate this feeling of pain that we feel. But it's not instability in a sense that we shouldn't move or we need to fear it or it's something wrong or bad. This is actually something extremely normal, healthy, it's needed for birth, right? And so it's just this increased sensitivity and sensation that we're feeling that we're calling and labeling instability. So if we can start to talk about what that means, you know, as we go through, I think that's what's really important. I'm still moving very, very consistently in typical workouts. 3 times a week at least, if not a little bit more, walking as often as I can. And what I do want to say as well is that I have had sensations of, that's interesting, especially when I get up from moving. I have this feeling of increased sensation, definitely high into my groin area or pubis symphysis area, goes away super quick. So I'm grateful right now that it's not holding me back from movement, and I don't want to negate the fact that this happens to a lot of people. This has happened to a lot of incredible movers that I know who are very educated about the body and move a lot and have had severe symphysis pubis pain. So I don't want to, put that out, but we just want to say, okay, what can help and what can change?
And just for anybody who might be wondering every time we say pubic symphysis or this symphysis thing, like how to find it, if you go from your belly button and just start kind of pressing down below your belly button, before you even get to your penis or vagina, you're going to hit this bone, right? And that's our top portion of our pubic symphysis. So you can actually feel and palpate that on yourself. And what the symptoms present like, it's really going to feel sharp in a lot of ways, like especially with changes in positioning. People will say like, oh, I get this sharp stabbing pain, a burning sensation, maybe a grinding feeling. And a lot, like you said, even with changes in position, if you're like laying down and suddenly you get up, standing on one leg or loading on one leg, going upstairs. So anything that's going to be kind of putting torque through that pelvis, which every time we take a step and we walk, we're going to be putting torque through that pelvis. It's going to point out some of those increased sensitivities where we might have a little extra laxity compared to what we normally do, or a little less stability.
When we look at it, especially if you Googled it, right? Especially if you Googled it, or some studies that just don't have concrete evidence, we're looking at quote unquote possible causes. And I don't always like looking at these things. I'm going to say that right up front, because there was a lot that I blatantly don't agree with, because I think it has to do so much more than weight, maternal age, misalignment of the pelvis. You guys know how I hate that one. So like, I don't agree with a lot of these blanket possible causes. If anything, I think if you've had a history of low back pain, yeah, you probably are more sensitive in that area already around the pelvis to have pain. If you've had pelvic trauma, so maybe you've been in an accident, you fell, you've slipped, you've had injury to this
previous
area
traumatic
before.
birthing experiences,
Yes.
things like that.
And then the one that really stuck out to me too was the lack of exercise.
And one of the last things that seemed to be a risk factor, fear is huge, because fear elevates the overall sensitivity of our nervous system. Any sort of anxiety around movement, any sort of anxiety to load in the positions that we might be having pain in, we start to then connect this fear with those pain patterns. And anytime we have fear about moving or fear of picking something up or going upstairs, we're actually prepping and perpetuating that pain through those pain patterns that we start to develop.
You know, and it's interesting if we go into like the general testing, there's 4 different movement activities that they kind of look at. That would be specific pain in the area. So again, we're looking at pain right in that front of that pelvis, right at the bottom. We're looking at pain with walking, standing on one leg, climbing stairs, turning over in bed. That's a huge one that I hear for so many people, and especially previous damage to any of these areas. So that's kind of like if you have all 5 of these factors kind of, you know, then we can say, oh, you have symphysis pubis dysfunction.
Certain treatments, especially the ones that we like to promote because it's what we do, it's movement based, it has to deal a lot with movement. And so education on load management, how can we maybe work within some of these movements, but scale back the amount of load we're putting through, keeping your legs together, because that's inherently a more stable position when you're getting out of a car or standing up from a chair.
Or turning over in bed.
Turning over in bed. Just like education on some of these movements so that we can put a little less torque through that pelvis. And of course, like rest when necessary.
We want to empower you that this is normal, natural, and this is okay. You're not alone in feeling this. And there are tools that can help. And one of those tools that is often talked about is a compressive belt. So this is like an SI belt you can look up. It's just going to help to aid in that compression low underneath the belly that helps to create this sense of compression, this sense of stability. How do we get up and move? And that's where we do want to go back into things like lunges, but maybe we want to put a different spin on the lunge. Rather than just lunging, whether it's forward or backward, we're actually thinking of taking our hip back and rotating through our core a little bit. We're getting this oblique kind of access from our shoulder to our hip to kind of work together. And that's going to actually help to open up that hip and pelvis, get a little bit more movement so that we're not compressing or putting too much force on different areas within the SI area or the pubis symphysis, the back. And we're going to actually help to lengthen those glutes and then shorten the glutes as we're doing lunging, as we're doing squatting, as we're doing deadlifting. Like our biomechanics and how we move and how we open up the pelvis becomes so incredibly crucial and really important.
Yeah, and something that I'm thinking of when you're saying all these, so like to jump from just like laying on your back and letting your leg go in and out to like doing variations of lunges and deadlifts and whatnot, it could seem like a jump, especially if you're somebody who's experiencing severe symptoms.
Yeah.
And what I'm thinking of are like the muscle activations that we do. There's tons of these muscle activations on the Gen Health platform. If you haven't checked out Gen Health yet, definitely should try it out. There's a free week trial that you can always get into. And if you just type in muscle activations, you can take a look at a lot of what's available, but it basically brings you to the ground and gets you to start putting some of these like alternating pressures on the body. And there's lunge variations where you have your feet into the wall or your feet up on a bench and you're pulling down through one heel while kind of pushing the opposite foot towards the ceiling. That's going to start to simulate that pressure that we put through our pelvis when we walk. We're pulling through one heel as we're pushing the other leg forward. So we're using kind of quads on one side, quads and hip flexors on one side, as we're using hamstrings and glutes on the other side. So, you know, something that you can do to even simulate that right now is get on the floor, get into kind of your bridge position, push down through one foot and just lightly lift the other one off the ground, right? And then push into that other one with your hand even. that, like Jen said, is going to start to get you to activate that oblique line in that supine or laying down on your back position, so that you can then maybe bring that into something like stepping up onto a stair or a lunge.
So Dom touched on it, right? That oblique line. If we look at like the fascial slings that Tom Myers kind of brought to our world, when we start to look at the oblique lines, we see how we have our external, internal obliques kind of cross into our adductors or our inner thighs, right? And so our obliques on one side cross to our inner thigh on the opposite side. And if we look at where that crosses, that's going to cross that pubis symphysis area. And so if I do exercises that help to support that inner thigh and that oblique line, or those obliques on the other side, and you can do, I think twisting becomes really controversial in pregnancy. Listen, you don't want to be doing like your rotational oblique things, right? Where we're taking a ball and kind of like putting it side to side. We don't want to be doing those types of things, but we can activate our obliques through chops. So being in a lunge, grabbing a band and doing some chops, we can start to activate where you don't even need a lot of rotation through your spine. And if we think of rotating more from the upper back rather than the low back, well, then we're not putting a lot of tension and pressure around the abdomen in general. So, there's holds that we can do. There's chops that we can do. Just starting to activate there's side plank variations where we can start to do like modified Copenhagen's on a knee, but that's going to start to get our inner thigh plus our oblique. And the side plank doesn't put as much pressure on your abdomen, especially the front of the abdomen, that we kind of want to avoid as we get later in pregnancy, as a regular plank. So a side plank is a good variation to take there. And then we also want to look at, our posterior oblique line, like this sling as well, is really important for that back of the pelvis. So how are we activating our lat and our glute? And you can do this, really easily. You can think of exactly the one Dom said, laying on the ground, putting your leg on the ground, kind of doing a bridge, and then pushing the opposite arm down into the ground. So one leg is pushing into the bridge, opposite arm, that's going to get the lat to the glute. You could also do like a lunge with a pull of the band. Opposite arm is going to kind of pulling that band as you're lunging with that single leg. All of these things, exercise, movement, create that internal support and stability without having to think of, am I kegling? Am I pulling that transverse abdominis on? Am I holding that core support exactly how am I supposed to? And it gets us into the single leg work, which is ultimately what we're having the most sensitivity with.
And doing a lot of this in preparation too, because sometimes like if you get into pregnancy and you start having severe symptoms, then, we're trying to work from a deficit. And when you're already having pain, it's really hard to build where your first goal is just getting out of pain in general.
Exactly.
And so anybody who's thinking about making the journey into pregnancy, that's where this is great to start. It's great to start now, even if you're not thinking about becoming pregnant for the next year or 2 years, kind of preparing your body for things like this. Kind of bring it back around to what Jen was saying, where you haven't had a ton of pain and you haven't had a ton of symptoms. You've had glimpses here and there with changes in position and stuff, but then you kind of bring yourself back to your own stability. And if I can give my 2 cents on why I think that is, I think it's like, okay, you have great mobility overall, like that's from gymnastics and just inherently now you tend to have great mobility, but you've continued strength training coming up to pregnancy, into early pregnancy. You took a little step back first trimester, but you kept moving. You were doing just slightly less weight in those resistance training. So you've continued to build and coach that internal stability into your body through all those oblique swings, through your pelvic floor, through your breath, and just like general core support. And so it's an anecdotal evidence of one. It's a case report of one person and yourself who's not really having pain, but you've been doing thoughtful activations and strength and resistance training throughout. And a lot of like the conservative treatment approaches that we've seen is exactly that.
And I will say, so if anyone's asking, well, what am I doing? I'm literally following my own full body low impact plan on Gen Health.
Yes.
So I started with phase 1 when we all did it together as a big community, which was so much fun to have so many people moving and doing it all with you. And then I've continued on. So now I'm in phase 2. By the time this comes out, I'm probably going to be testing the phase 3 that we're going to release as well. And it's just so easy, one, to have a plan to come to every single day and not have to think. And so that gets me exercising and doing that resistance training at least 3 times a week. Sometimes I'll add another workout if I'm feeling good. So 3 to 4 times a week, I'm strength training. And then outside of that, I'm doing the modified core because I show modifications, and I have this little pregnancy highlight on the front of my page that's called Pregnancy Mods. And I give some of my, like, how I'm modifying some of the movements where I'm not laying on my stomach or I'm not doing the core. So I kind of show some of those modifications that you can look at. But I'm literally doing the full body low impact plan because, like Dom said, it has the muscle activations, it has the mobility, which isn't just stretching, right? It's actual activations. And I'm doing the strength workouts. I have taken a step back from HIIT just personally on my body. I notice when I get swelling and I know that my body's working a little bit harder than it probably needs to. So I back off of a lot of HIIT type movements, and I'm focusing more on walking and strengthening and doing the literal full body low impact plan on Gen Health. So if you're confused of how to access that plan, we're going to have it linked up where it's just gen.health/free trial. And that's how you can start a free trial on Gen Health. And then if you choose full body as your body part when you're coming into the plan, that's how you'll see the full body low impact plan on your homepage.
Or the core plan, which also is great to explore the core and pelvic floor and start to find that activation if you've ever heard us talking about that and are wondering, how do I get that? So,
I mean, I would say that one's a little bit harder during pregnancy though, because there are going to be a lot more modifications.
Where you're laying on your belly or something like that.
Yeah. So I would say, I mean, honestly, full body low impact plan, you're going to get all the pieces of it. It's so important. And then I want to circle back to what I said, one of my best friends who was having pretty severe symptoms, and now she's not having symptoms and she's well into 3rd try. What she's really changed. So yes, we got together, and her symptoms have already calmed down a bit, and we did some of the exercises that we were talking about, and those helped. And she really had a lot of tightness, I would say, in the back of her pelvic floor muscles. And so getting her to understand how to open up and kind of get into the back of her pelvic floor was really beneficial. But the thing that she just told me that's changed the most and had the biggest impact is sleep. So she was normally working night shifts as a nurse, and she asked to switch that over to day shift. So now she's eating at normal times throughout the day. She's sleeping at normal times throughout the day, and she has no more pain.
Yeah.
I mean, that's everything, right? If we talk about pain symptoms, it's not just movement, but it's your emotional well-being, it's your sleep, it's stress, it's all these components that add into having increased sensitivity in your tissues.
Thanks again for joining us for another PT Pro from the Optimal Body. Again, if you learned anything, comment below. Please consider subscribing or hitting the notification bell, and we'll see you next time.